Hi everybody, for this workshop you were assigned to read 4 articles. Each article had something to say that was either prioritizing a certain part of design or giving helpful tips while working on a layout for our designs. Here's how we can apply these to our own clinic in downtown Chicago. Let's talk functionality first. Remember, the main user of this clinic, though the patients will be in there, will be the clinician. We must make their lives at work not overwhelming or frustrating. A consultation room is a place where the patient gets to have multiple conversations with their clinician, but it's also a place where it's possible that more than one clinician will be using. The layouts of each room should not be completely different. They can be, if it makes sense for the user. If the plastic gloves are always in the drawer and next to the sink, it should probably stay the same for every room so there's uniformity for the clinicians while using the space. Alright, so let's move on to technology. Many of our past workshops have mentioned some sort of technological integration. If you remember reading this in the Steelcase article, it is mentioning that having a screen for the patient to see and better understand their diagnosis will allow for a better patient experience. Moving into our clinics, I find it important to take into consideration that our consultation room is an opportunity for a clinician to educate a patient, not make them feel stupid or uncomfortable. With the integration of screens, we are allowing for a better conversation and a more informed patient. Lastly, let's talk about location. The Art of Healthy Living article posed a question that I found important for us to take into consideration. Ask yourself who your largest client base is. We are in downtown Chicago. Though it's in the Midwest, it is far from being similar to West Michigan. The demographic will be very different. We have to make sure that as we do research, we pay attention to our client base. Because the last thing we want is to have an elderly person in our waiting room taking a teen magazine quiz because there was no other distraction. Though this seems like a small detail, it affects the patient experience, and that should be one of our priorities. So that's it for that, so let's move on to discussion. Here are 3 questions that I would like to see you all answer on the discussion board. Question 1. When you're in the consultation room, what are some of the first things you notice that you wish you could change? This can be how you feel in the consultation room or specific layout changes. Question 2. From the many different pointers that the article gave, what would you say is the most important out of physical features? Those features can include lighting, noise control, temperature, color scheme, etc. Question 3. With the pandemic state of mind, what would be your biggest concern with the consultation layouts we have now and the ones presented in the articles? And for your assignment, create an 8.5 by 11 board for a consultation room that includes an overall palette, that being wall paint, bleach cleanable seating fabrics, bleach cleanable table surface materials, and a flooring material. Alright, let's get at it!